Okay, so London has just been categorised as a tier 4 city, as well as, other parts of southeast of England. Cheers, good old COVID. No, literally, we've actually known about COVID for more than a year now, and sort of getting ridiculous, I'm not gonna lie.
Hey guys, this is Future Nikhil here. I was just about to get into editing this video. Oh wait, by the way, hope you guys had a fantastic new year. Hope you guys spent time with those close to you. It's been a while since I recorded this particular video, and since then a few COVID developments have been made. As of today, which is the 4th of Jan 2021, Boris Johnson has just announced that the whole of England is going to go into lockdown number 3, which means that schools, both primary and secondary, are going to go or are going to shut down starting tomorrow. But on a more positive note, the second sort of vaccine, the Oxford/AstraZeneca vaccine, has started to be administered to those people at high-risk groups. And for those who may not be aware what these groups are, there are those who are above 70 years, frontline/healthcare workers, residents and workers within the care home, and also people with immunocompromised conditions that make it easier for them to catch the virus or make it harder for them to combat the virus once caught. So that's pretty much all I wanted to tell you. All right, this is Future Nikhil signing out.
So I just thought there is no better time than now to actually talk about COVID from the start to now, and how interviewers may use questions about COVID on the big day. There are some important aspects that I want you guys to actually know and be aware of, to maybe help you directly answering this question, or using this information as a sort of like a reference or support when it comes to answering something a bit more vague, like how should a country deal with a pandemic, and then there is no better example than COVID. So yeah, I just think this video is going to be helpful regardless of what sort of avenues you guys take when answering a question. So this video will talk about the origin of COVID, where it first started out. I know most of you probably already know this, and how it sort of found its way into the UK, whether the first lockdown that happened in March actually worked, before talking about the concept of herd immunity, which is what one country in particular, and I'll get to that later on, sort of tried to adopt to help tackle COVID-19, and our government's sort of response as a whole, just to conclude and tie everything together. Without further ado, let's first begin with a brief background about COVID. Well, the first sort of confirmed case of COVID was actually, I believe, 31st of January 2020. However, some people think that the confirmed cases of actual COVID within the UK have sort of predated even this. So how did COVID reach the UK in the first place? So scientists have done large-scale data and genomic sequencing to try and sort of extrapolate where COVID came from, what countries, and they found that about a third of the transmission lineages came from Spain, 29% came from France, and 14% came from Italy. However, it's important to note that these results were entirely preliminary, and there was no sort of peer review that was done in order to validate the authenticity of these results and actually check if they're 100% true. So basically, these were sort of educated guesses more than definite answers. Now let's talk about the first lockdown. So on the 23rd of March 2020, because I don't really know when this video is going to be going up. However, in March 23rd, 2020, our beloved Prime Minister Boris Johnson has announced that strict lockdown regulations are about to be put in place. And on 3 days later, on the 26th of March, was when lockdown was officially announced by the government. These measures meant that you were only allowed to go out for essential stuff like food shopping or shopping for medicines, or you were only permitted for one exercise a day, or you're allowed to go out in order to care for a vulnerable person. It was initially meant to last 3 weeks before being reevaluated. I think so. On the 15th of April, Northern Ireland announced that it was going to extend its duration of lockdown until May, and the first Secretary of State, Dominic Raab, sort of followed suit. And at this time, when they were first sort of announced this, there were around 15,000 confirmed deaths and over 100,000 confirmed cases of Covid-19. So, fast forward a few months. So lockdown started to be eased on the 10th of May, where people were allowed to go out and meet with people, albeit in small groups. And a month later in June, shops and all the non-essential like restaurants and pubs, they all started to reopen again. Now, a question that they may directly ask you that's directly pertinent to Covid-19 as a topic is whether lockdown, or the first big major lockdown, worked. And there are a few things that I want you guys to consider. So I'm not going to give you answers, just going to give you nuggets of information, just food for thought for you guys to consider and develop your own sorts of answers. Now, it's important to first determine what the purpose of the lockdown was. If it was to drive down infection numbers, then it worked. If it was to reduce the burden of the NHS, it worked. However, did it come with a cost? It's important to know that there were many sort of extra deaths that happened because of the lockdown. There have been increased cases of deaths of people who were waiting for elective treatment, elective surgeries. For those who don't know what elective is, it's basically anything that is not an emergency. So people were sort of denied of any sort of elective surgeries or treatment because most of the beds were actually prioritized for any COVID cases. And I'm sure some of you may have experienced this effect directly, or may have known other people, other friends or family members that have gone through similar sort of experiences, is that mental health has sort of drastically deteriorated due to the lockdown. It's so important for us to go out and see friends and family outside, over a beer or over in a park. And when you weren't allowed to meet in groups, and when you weren't allowed to see family, the rates of suicide have sadly increased as well. And also because a lot of people lost their jobs during this time or took a large pay cut, there's increased tension within the family, and this led to increased number of domestic abuse cases as well. In addition, it was also stated that even though lockdown helped reduce or curb the transmission of COVID, it actually didn't save any extra lives. However, some people might argue that lockdown was the only sort of option, because when the first lockdown was announced, there was no suitable test and trace system, unlike in Germany, for example, who had a really effective test and trace system quite early on. And also, can people be expected to sort of abide by the social distancing rules and follow lighter guidelines? Do we need lockdown to enforce this behavior? Well, lockdown 2.0 kind of answered that question for us. Sweden, which I'm going to get to in a bit, didn't actually have a lockdown. It basically entrusted its citizens to, like I previously mentioned, to abide by social distancing and lighter guidelines without actually imposing a lockdown. And some people argued that it might have worked, while some people argued that it didn't work. And this actually transitions nicely into the concept of herd immunity. So I think all the way back to the start of March 2020, the chief scientific advisor of the UK's government, Sir Patrick Vallance, put forth this idea of herd immunity. He proposed that 60% of the people need to get affected with COVID-19 and would have developed an immunity or an immune response to COVID-19 for this to work. So take the 60%, take a group of 10 people, and suppose 6 of them catch COVID-19, they survive, and they've developed an immune response or an immunity towards COVID-19, and the other 4 did not have COVID-19, it is essentially impossible for them to catch the virus. I hope that makes sense. But then again, this proposal was refuted by hundreds of scientists, saying that you're putting people at unnecessary risk of dying. There is no guarantee that the 60% of the people that do get affected all survive and develop an immune response. There are those people who are elderly or who have an immunosuppression from infections such as HIV, or they might be on chronic chemotherapy treatment that really curbs down your immune system. So this idea was sort of abandoned quite quickly, hence the sort of lockdown rule that was put into motion a few weeks later after this proposal. So let's go back to Sweden. So it's done something that surveillance tried to get the UK to do, which was rely on herd immunity in order to contain the spread of this virus. But did it work though? So although at the start it did look like that it was working, it was only a matter of time that Sweden started to implement stricter restrictions. And Sweden hadn't actually achieved this herd immunity. So if you take Stockholm, for example, in Sweden, the Public Health Agency found that only 7.3% of the residents in Stockholm had developed an immunity for COVID-19, far from the 60% that was suggested by surveillance. And what's strikingly sort of remarkable was that Spain and France reported similar numbers in terms of the percentage of the population that developed an immune system, but they both chose to go into lockdown, as with the rest of Europe. So getting the people exposed to COVID-19 for them to gain an immune response didn't really work, because you could achieve the same results with everyone locked down and essentially a lot safer relatively to the COVID-19 virus. There are a few sort of events that you should be aware of on how the government sort of responded to COVID-19 as a whole. The start was not good. A poll showed that around 3 million people went hungry within the first 3 weeks of the lockdown announcement. Doctors were actually told to wash and reuse PPEs whenever stocks were running low. Some doctors even had to resort to dipping their hands in a bucket of sterilised water just because they ran out of hand sanitizers. PPEs, for those who don't know what the abbreviation is primary protective equipment. It's something doctors or any sorts of healthcare professionals have to don, like an apron and a visor and goggles and gloves, when dealing with any sort of contagious patients, and COVID-19 was quite contagious. So a question could be, did the UK government handle this pandemic well? It's really important. I should have mentioned this point right at the start of the video, that because this is a controversial topic, it's important not to have your own opinion when you're talking about this. It's always important to talk about both the good and bad, or both for and against a question. So for example, if you're answering this question, did the UK government handle this pandemic well? You need to talk about what they did well, what they didn't do well, and then come with your own opinion right at the end. So for some sort of points that the UK did well, they offered quite a sizable economic support for those who found themselves losing their jobs or taking a huge pay cut. If you want to know more about it, it's called the Job Support Scheme. Just to summarize really quickly, in Tier 1 and 2, the government paid slightly less to the workers than it did for those who completely lost their jobs in Tier 3 businesses. Another good thing that came out of the pandemic was, the construction of the Nightingale services. But what actually happened to them? So if you didn't know, there were 7 Nightingale hospitals that were erected within the UK to cope with the feared sort of pressures of a large influx of COVID-19 patients. While they were sort of, quite applauded by the ministers within the UK, they weren't really put to much use. In fact, a lot were sort of repurposed for other reasons. The Nightingale Hospital in London had COVID patients turned away due to quite significant understaffing, whereas a few Nightingale hospitals weren't even put to use at all, and they're still on standby. Well, they were on standby anyway. However, many argue that the whole response by the government was too little, too late. So that's essentially what I hope is a brief overview of the COVID-19 situation. Of course, some places are, constantly changing from one tier to another, and definitely this is something that you guys can definitely use. If not directly, then indirectly, to sort of answer a question such as, how do we tackle the pandemic? And then you can use the example of the UK's government, what they might have done right, what they didn't do right, and how you can improve for any sort of future occasions, which I hope will not be the case. So yes guys, so that's sort of like a whistle-stop tour. I hope that's a whistle-stop tour of COVID-19, and I hope you guys found this video useful. So if you have any questions or you didn't understand anything from this video, leave a comment down in the comment box below and I'll make sure to answer them as soon as I can. So yeah, good luck guys.